Nocturnal adaptation to pregnancy. Okay. So, in 36 weeks po, yung ovum, which is the fertilization, nagmamature po siya from a single cell and nagde-develop into a fetus and hanggang sa mag-born po si baby. There are 3 fetal development po of 3 periods of fetal growth and development. First is the pre-embryonic. Pre-embryonic is the beginning of the fertilization, followed by embryonic, which is the week 5 to 8, and the embryonic fetal is the week 8 until term. Okay, so sa mga definition of terms, yung ovum is from ovulation to fertilization. Zygote is for fertilization to implantation. Embryo is from implantation to week 5 to 8, and the fetal is from week 8 to until term. So, moving on po dun sa mga cardiovascular changes po natin, si mami po ay nakakaranas ng easy fatigability and shortness of breathing. It is due to increased workload of the heart. Another manifestations is murmurs. Nagkakaroon po ng whooshing or humming of the sounds dun po sa heart ni mami. Dahil po sa nagkakaroon po ng viscous yung blood po ni mami. And another thing po is yung slight hypertrophy of the heart. Nagkakaroon po ng nagiging mahirap po dun para po sa blood mag-pump, and kaya nagkakaroon po ng pressure po dun sa left ventricle, and hindi po nagiging efficient yung pag-blood po ni heart, yung pag-pump po ni heart ng blood all throughout the body. And also nahihirapan din po si mami, nag-i-increase din po yung cardiac output dahil po hindi na po basta sa buong katawan lang po ni mami na pinapadala yung mga blood flow, but also doon na rin po dun sa baby na rin po nagkakaroon po ng blood flow sa uterus. Okay, so moving forward po dun sa varicosities of the extremities, is due to weight of the uterus. Yung management po dito is no to prolonged sitting and positioning, seems position, and then kapag nakaupo hindi po nakabend yung knees. And another thing po, another manifestations is the palpitation. It is due to sympathetic nervous system stimulation. Management for palpitations is gradual slow movement. Hindi po maging mabigat yung mga gawain po ni mami, and dapat hinahinay lang po sa pagkilos. And another thing naman po is yung edema of the extremities. Management po dito ay dapat naka-elevate po yung lower extremities po at hip levels, and dapat naka-positioning left side lying po. And moving forward po din sa varicosities of the renal or yung hemorrhoids. Hemorrhoids is due to poor circulation and the pressure po dun sa growing fetus po. And so yung management po natin sa hemorrhoids is to apply stool softener, gentle finger pressure, at saka po yung increase water intake and fiber. Next naman po, moving forward po dun sa gastrointestinal system. Yung nausea and morning sickness, nausea and vomiting due to um, yung pwede po nating maging management po for nausea and vomiting is yung give dry crackers po and before arising in the morning. So another thing for morning sickness po na pwede pong maranasan ni mami is yung hyperemia gravidarum. Hyperemia gravidarum is the excessive nausea and vomiting. This may lead to starvation, dehydration, and yung acidosis. And yung pwede po nating management dito ay complete bed rest. And syempre po, yung D10 NSS, 3,000 ml in 24 hours. Another thing naman po is yung heartburn. Heartburn is the reflux of the stomach content to the esophagus. Ang dapat po nating management po sa heartburn is avoid fried fatty foods. Tapos, pwede rin po natin bigyan si mami ng food pero dapat konti-konti lang. And kung when it comes to sips naman po, pwede po pero frequent interval lang. Another is yung pica. Pica is yung food cravings po na pwede pong mag-occur during the pregnancy. And next naman po is the Pitalism po, yun po yung pitalism is pitalism. Moving forward po dun sa reproductive system, respiratory system po ni mami. Shortness of breath, pwede niyo po maranasan yung shortness of breathing po, and this is due to yung uterus po, nag-i-increase po siya ng size, kaya yung diaphragm po ni mami na naiipit po, and naiipit po yung nagkakaroon po ng pressure po dun sa diaphragm, kaya nagkakaroon po ng shortness of breathing sa mami. And pwede po nating maging management po sa shortness of breathing po ay yung limit po yung activity po ni mami. And next naman po is yung urinary system po. Urinary frequency, pwede pong maranasan ni mami yung stress incontinence or the involuntary loss of urine. And this is due to increase of high in progesterone and estrogen. And ang pwede pong management po sa urinary frequency is yung educate po natin kay mami yung Kegels exercise po, and do not restrict water intake. Another thing naman po is yung sa mga sugar po sa blood po, pwede naman po na it is very difficult po for a pregnant woman na i-diagnose po si mami ng DM, kasi po yung mga ihi po nila is nagko-contain po ng sugar like glycosuria, nocturia, and proteinuria. Glycosuria is the glucose in urine. Nocturia is the frequent urination at night. And yung dapat po nating management sa nocturia is yung 2 hours wala pong water, 2 hours before hours of sleep or before bedtime. And then yung proteinuria naman po is yung protein in the urine. Another thing po pala is positive po in proteinuria and positive din po sa hypertension, may result po sa preeclampsia. So without hypertension and without proteinuria, will be considered all goods po. Another thing din po sa GDM, sa mga mommies po sa mga pregnant mommies po natin, pwede po silang makaranas po ng diabetes, GDM, or gestational diabetes mellitus. Nag-occur lang po ito during the pregnancy, and ito po ay dahil po sa macrosomia, or yung malaki, si baby po ay malaki po than average, than usual. Moving forward po dun sa musculoskeletal, Sa positioning po ni Mami, nagkakaroon po ng changes. Lordotic position po si Mami. Lordotic position is the pride of pregnancy. Nagiging lumba dahil po dun sa center of gravity po. And ang si Mami po, dahil po dito, nagkakaroon po ng increased risk for falls po si Mami. So, ang management po natin for lordotic position is, instruct po natin si Mami na mag-wear lang po siya ng flat shoes. Another thing is leg cramps. Dapat po, kapag nakakaranas po si Mami ng leg cramps, ito po ay dahil po sa pressure po na nararamdaman po in the lower extremities. So, our management for leg cramps will be naka-flat po si Mami, naka-lie po yung back ni Mami, and then naka-extend po yung involved leg na may cramps, and then dapat po nado-dorsiflex po natin yung foot niya po until na mag-disappear po yung leg cramps, until na mag-disappear po yung pain. And another thing is moving forward sa reproductive system. Nagkakaroon ng cervical changes, vaginal changes, breast changes, and weight changes po kay Mami. But before that, I want to proceed din po muna sa true labor and the false labor. By manual examination first. We have Heger signs, Brixton-Hicks management, and ballotment. Sa Heger sign, it is softening to touch. The fetus is soft to touch. So, sa ballotment naman po, ballotment is yung bouncing. Nararamdaman po yung pag-bounce po ng fetus po dun sa amniotic fluid. And the Brixton-Hicks contraction naman po is yung hardening of the uterus. It's also the contraction of the abdomen. So, moving forward po dun sa true labor and false labor. Mnemonics for true labor is a D. D stands for decreased interval. I is for increased frequency. L is for lower back pain. Lower back pain. I is for intensified pain and increased contraction. Next naman po is yung false labor. In true labor po kasi, dapat po yung pain po na nararamdaman ni Mami ay nandun po lahat sa lower back pain po. And kapag false labor naman po, it will be liar. So, L stands for lower abdominal pain. Wala po sa lower abdominal pain, wala po yung pain sa lower abdominal po ni Mami. So, kung doon na po nararamdaman yun, it will be false labor. Next naman po is I, is the increased interval. I is the estrogen or the Braxton-Hicks contraction or the hardening of the abdomen. And the R is the relaxing, relieved at walking. Hindi po nare-relieve ang pain po ni Mami kapag naglalakad po through walking po. And even if it's relieved po, it is false labor naman po. Next naman po is yung after the true labor versus false labor, let's move on dun sa mga cervical changes po na nararanasan po ni Mami. First is the Gödel sign. Nagkakaroon po ng light pinkish to violet hue changes. Next is the operculum sign, and the sa vaginal changes naman po, nagkakaroon po ng pag-darken po ng vaginal, and nag-i-increase din po yung pH level ni Mami. From before, it is 7, and during pregnancy naman po, it is dahil so acidic na po si mommy. Pero this is also good because napoprotektahan din po si baby from any bacterial infections. And another thing naman po is yung weight changes po ni mommy. As a breast changes naman po, nagda-darken po yung areola ni mommy, and nag-i-increase din po yung size po ng areola. So meron pong nag-help po dun sa nipples po ni mommy para po makapag-supple and para hindi po magkaroon ng drying or cracking po during lactation. And it is the monogamy tubercles. And in weight changes naman po, nagkakaroon po ng weight gain po si mommy up to 10 to 12 kilograms or 20 to 25 pounds. So all of these things that I have tackled is all about the maternal changes, maternal adaptation to pregnancy. And thank you for listening. My name is Rochelle A. Hernandez from BSN 206.